Hello everyone, we're going to be walking through Medicare Compare USA's online quoting platform, which also includes the EApplications, Document Locker, Electronic Scope of Appointment document signing, and the new Client Manager. We're going to be starting with the quoting tools, and we're going to start with Medicare Supplement. So in order to start a new quote, we'll click Run Quote underneath Medicare Supplement. This will take us to the quote search page. With the new Client Manager, we can either click a client that we've already created here to select that client, or we can enter a new client's name. So I'm going to enter MC Test for Medicare Compare Test. Then we click Create New Client, MC Test, and we will pretend that this is our client we're running the quote for. And now as I enter the zip code, age, gender, tobacco status, it will remember that MC Test, this client here, has the following credentials. We can choose how we'd sort the results by, so price, meaning least expensive to most expensive, AM Best rating or SP rating, you can visit their websites to learn more about those ratings, or company name, meaning alphabetically. We're going to leave this at price, so it will sort least expensive to most expensive. We can then select our plan type, choose our effective date, which we can always move this out into the future. So if we put this for November 1st, we can see any rates that go into effect between now and November 1st. We can also choose whether or not the household discount is applied. We can also select Show Advanced. This will allow us to add any underwriting filters, so we can select any health conditions. So maybe we have a heart attack. This client's had a heart attack in the past. We type that in as well as the event occurrence, and then we click Add Filter. Same goes for medications. We can select any medications the person's taking, the associated condition, and then click Add Filter to add this to the quote. Any health conditions or medications will then be populated here, and to remove them, we'd click the X. When we add in these health conditions and medications, it's going to make sure that we only see results for clients, carriers that would not have these health conditions or medications on their knockout drug list. So any of the carriers that will show do not have these health conditions or medications on their knockout drug list. Once we've entered all of our quote information, we'll go ahead and hit Get Quote. And then like I said, we're only going to see the results that do not have this health condition or medication on the knockout drug list. So here we can see the heart attack that we listed, and we see the carriers that do not have that on the knockout drug list. Now if we click this underwriting filters on the left-hand side, we can see that right now it's turned on, which is why heart attack shows here. But if we click this again, it's going to remove that heart attack, and now it's going to show all of the quote results. You can see they're sorted least expensive to most expensive. So we have the premium amount here, $97.65 a month for Resource Life Insurance Company. We see the parent company name, AM Best rating, rate type, plan type, S&P rating and rating class, the years in market, and the effective date of this plan. So even though we ran a quote for November 1st, we can see that this specific rate went into effect on 1/1 of 2020. On the left-hand side, we can see that our quote is expanded, but if we uncheck mark this, they will go ahead and contract. We can apply the household discounts if there is one, and it will show what that household discount is, and then what the rate is with that applied. We can see the annual rate, the market analytics. We can choose to include select plans, or again, the underwriting filters that we already discussed. For the market analytics, we have age increases, increase history, and market data. The age increases here shows us, we'll move this back to monthly premium. So we ran the quote for a 65-year-old. But what the age increases shows us is for the next 4 years, so for 66, 67, 68, and 69, what a person is currently paying at that age. So we can infer how this plan may increase as a person ages. The increase history shows us the previous increases or decreases that this plan has taken. So if we scroll down to State Mutual, we see that data here. We see the past increases or decreases, and then the average of those rate changes. And that's based on the rate changes that the company has taken. The market data shows us both on a national and state level the number of lives that are covered, the premium amount, loss ratio, and market percentage. We can use these arrows to switch between years to see how this has changed over time. If we ever forget what any of these pieces of information mean or where the data is coming from, if we scroll down on the left-hand side under Options and click About Quote, we have this handy little cheat sheet here that shows us for the age increases, increase history, covered lives, market percentage, premium amount, and loss ratio, what each of these mean, and what the source of that data is. Another great feature of this quoting tool is we can select up to 5 plans at once by clicking this bar, and it turns green and populates these plans under the compare quotes. We can select up to 5 at once to compare side by side, but I'm going to just select 3 here for this example. Once we select the plans we'd like to see, we can click compare quotes, and we'll see a side-by-side comparison of the 3 plans that we've selected. Then we can choose to do a PDF download of this page, or we can print this page, or we can click the back button to go back to the entire quote result page. Once we get back to the quote result page that shows the entire list of quotes here, we can then click the X to remove any plans from the compare quotes and select new plans to compare, or we can export the entire quote list. So we can click this print button, the PDF button, or this Excel button to download the entire quote list result. I'm going to click here the PDF download, and I'm going to show you what this would look like if you were to download this for your client. The nice thing about this download is it's very neat, it's very concise, and everything looks very professional, so you can provide your clients with a quote, and then you can download this, and so they can take it home with them and review their coverage options. We'll wait for this to load here. It's telling us that this PDF is now downloading. Another great feature of this Medicare Supplement quoting tool is we can click quote options at the bottom, and it will say view plan details, and we can review our Part A, our Part B, or Parts A and B coverage, or our plan details, and then we can also click other benefits to see these. We can print these plan details. If we click quote options, we can also click visit the carrier resources, and that will take us to this carrier's website. So our PDF quote is done downloading. Let's take a look at what this looks like here for us. You can see it has the agent name at the top, the phone number, agent email, and then for MC Test, this of course would be our client's name, it shows the zip code, age, gender, tobacco status, and plan we ran the quote for, as well as the effective date. It then shows us any of the health conditions or medications we added, as well as the entire quote list. So a very nice PDF, and if you add in your picture, this will also be included. I'm going to take us back to the dashboard, and we're going to move to the next quoting tool, which is our Medicare Advantage or PDP quoting tool. So if we click Run Quote, again, we can select our client or add a new client. If I select a new client that's already been listed here, so Henry McDonald, it's going to pull in his zip code, and that will already be saved here for our client. So any of these clients we select, it's going to remember their zip code. See, as I select a new client, it remembers a zip code that I selected for this person. So that's very nice that you don't have to remember their zip code and things of that person. So we have the zip code, we have our plan here. We can run Medicare Advantage, Medicare Part D, or a special needs plan. We can select a filter here, the effective year, and how to sort the results by, so price or company name. And with the $0 premiums, it's going to sort by max out of pocket. We can also select our low income subsidy level if we would like to. So we'll select 75% for this example, and then we'll go ahead and hit Get Quote. Similar to the Medicare Supplement results page, you can do a print export, a PDF download, or an Excel download of this entire quote results list. We can select up to 5 plans at once to compare side by side, as we showed with the Medicare Supplement quoting tool. So a lot of these are very similar. We can then print this page or do a PDF export of this page. We can also click Fill the Gaps. This is a great feature here. So if we click Fill the Gaps, we can run a hospital indemnity quote within this Medicare Advantage quote. So we just double check the quote credentials, click Run Quote, and then we can actually select a hospital indemnity plan to fill in any coverage gaps with our Medicare Advantage plans. So maybe we want to select this Medico insurance company hospital indemnity plan. We can click Add to Comparison, and then as I said, we can fill in the coverage gaps of the Medicare Advantage plan with the hospital indemnity plan. So here's my hospital indemnity plan. I can select different benefit amounts to fill in any coverage gaps. I'm going to take us back to the full Medicare Advantage quote results page. And you can see that we can also expand or contract these quotes. We can see the annual rate. We can see market analytics. So for Medicare Advantage, it's the county penetration and company enrollment. We can also view plan details or visit the carrier website. I'm going to take us back to the dashboard to move to the next quoting tool, which is Final Expense Life. Again, we can select a client, or we can simply enter in a zip code, age, gender, tobacco status. We can select a face value of our final expense plan, or we can choose a monthly rate. So if we type in 30, it will only show us plans that are within $30. We can choose our product type, our underwriting type, and how we like to sort the results by. We'll hit Get Quote. And as you can see, as I move through the quoting tools, a lot of these are very similar in the way that they function. So once you get the hang of one of the quoting tools, as you move to a different product to run a quote, it's very similar. So it's very easy to pick up on. Just refreshing this page here. So we hit the $30. You can see now it actually defaulted back to the $10,000 when I hit Get Quote again. But if we hit that $30 monthly rate, it's going to show any plans under $30. But for this face value at $10,000, we can see the premium, the company name, annual fee if there is one, and the rest of the plan details listed below. We can click Apply Fees to see how that affects the monthly premium. We can export by printing or PDF. We can do the compare quotes, as we did previously. Or if we want to compare maybe a final expense plan to a dental plan, we can do the universal compare. So the compare quote, where we just select this and turn it green, that's the same product line. So final expense versus final expense, Medicare Supplement versus Medicare Supplement. But if we wanted to compare final expense to maybe a dental plan, we click this universal compare, which turns it purple, and then we can compare different products side by side. I'll go ahead and show you that now. So I click this globe to turn it purple with universal compare, and it's going to save under universal compare. And as I go back to the dashboard and move to the next product line, which is dental, it's going to save that previous plan for me. So I'll enter the zip code, gender, age, tobacco status. Then we can choose if we want to see just dental or vision plans, and we can also choose our covered members. We will hit Get Quote once we've entered our information. And as we see the quote results, we will notice that under Universal Compare, we still have the plan that we selected. So if we now select this globe again, and then click Universal Compare Quotes, we can compare the dental quote that we just ran next to our, I think it was our final expense, our final expense plan here. So then you can compare different products side by side. Again, you can print or PDF export this page. I'll click this back arrow to bring us back to our full results. And again, you can export this entire quote result list. So a lot of different quote options here. We can view the plan details or visit the carrier resources page to take us to the carrier's website. So again, the same options that we have for all the quoting tools are available. We're going to take us back to this dental quote results page, back to our dashboard, and we'll go ahead and move to the next piece, which is our document locker. So the document locker allows you to keep all of your documents in one place. Maybe you're someone who has a huge stack of papers on your desk, and there may be electronic scope appointment forms that you've done that are paper. You can go ahead and scan these in and upload them to the document locker, or store any documents or quotes that you've ran for that matter. So maybe you have 2020 AEP documents. Maybe you have some quotes that you're in for clients that you've downloaded, as I showed you with the quoting tools. Maybe you have scope appointment forms. You can create folders here. So maybe I say Maria Quotes. Create. Maybe this is Maria's quotes. Maybe it's a client we've been working with. We can create a folder for her so that when we run quotes for her, we can drag them in here. We can upload any documents. So as I said, maybe you want to scan in some documents you have sitting on your desk. We click this upload button. We can upload any files. And then we can always export this locker library. So if you ever need to get all of these documents to a new place to store them, you just click export. You can move them all there. We can search for different documents by clicking in here and typing maybe a different client name to find any documents in this document locker. But the most important piece, or the biggest piece of this, is the electronic scope of appointment. So in order to create a new ESOA, or scope of appointment electronically, we'll click Create Electronic Document. We can see any of our incomplete or in progress documents listed here, or we can also click Start Document. We can preview what this looks like, but to start it, we'll click Start Document. And then we can document title here, so we'll say MC Test again for Medicare Compare Test. We'll click Save and Continue. So I, as the agent, start this ESOA form. We'll scroll to the bottom, make sure we read the terms and conditions, click Continue. And the great thing about this is it's a universal electronic scope of appointment form, so you can use it for any carrier. It will ask for the same physical location as our client. If we're not, we'll do the email signature link, but in this case, we're going to say we are, just so I don't have to open up that email during this demo. So we'll say applicant provides identifying information. If we do the email signature link, all it does is sends the applicant or the client a link and a verification code. So then all they need to do is click on that link and they'll enter the verification code to sign. So it's very simple for them. We'll click Continue. And then we'll check how we want to discuss these plans. So we'll maybe say dental vision. We'll say the applicant's name is Maria. We will say the mother's maiden name. We'll say test. The last four of the SOCH. The city that we're signing in. The state. The zip code. And then we'll click Apply Signature. So we'll go ahead and sign and continue. So again, the applicant, we're pretending that they're with us. They would give us that information. We'll say the agent name. We'll enter the phone number, the beneficiary name, the address. Again, I'm just entering these in quickly for the demo purposes, the zip code, and then we can say maybe they were just a walk-in client, and then the plans will say dental, maybe any plans that we discussed, we'll say Medicare Advantage as well. The date of the appointment, and then we'll go ahead and click Continue. Now, as I'm filling out this information, it's actually filling a PDF for us. So we'll go ahead and as the agent, I'm going to apply my signature, so it carried my name over. I'll click Apply e-signature, and then I will click Sign. So since we said the applicant was with us, this is now completed. I can click Save to Library and it will automatically save to my document library, and it's going to show me this document preview here, and as you can see, all this information was filled out as I entered it. So we're going to go back to our document library here. So I'll go back to my document locker. On the left hand side I can navigate, and then you can see that it saved it here in my document folder. It went to my folder that I had created, and it's all in one place, so it makes it really easy to be able to quote and store these documents all in one place. I'm going to take us back to the dashboard. So that's our electronic document locker and our electronic scope of appointment forms and how we'd sign that. Now I'm going to take you into the EApplication. So there's a few different ways we can go into EApplication. If we want to start a new EApplication, we'll start by running a quote. So I'm going to go ahead and enter my quote, credentials, the zip code, age, gender, tobacco status, and plan type as we would. We'll click Get Quote. And again, this is how you start a new EApplication for a Medicare Supplement plan. We'll notice that any of the plans that have the EApplication will have the Apply Now button listed there. So I'm going to do United World today, and it has this Apply Now button. So that's how I know that I can do the EApplication for them. So I can click Apply Now if I want to start the Medicare Supplement EApplication, or if I want to do multiple products, so maybe a Medicare Supplement plan as well as a dental plan, I can click Add to Cart, so then I can do multiple applications at once. But if I'm just doing a Medicare Supplement EApplication, I'll click Apply Now. Otherwise, I can click Add to Cart, as I mentioned, and it will go to this cart up at the top, and then I could do two at once. So the first time you're doing an EApplication for a particular carrier in a particular state, you will need to validate your producer number. I've already done this before, so it remembered me. I'm pretending to be David Perlberg, and here's my producer number. And then, of course, I can move through this EApplication and just go through, and it will be submitted directly to the carrier. So that's how I'd start a new one. If I want to go to an EApplication that I've already started, I can go to View Applications, or from the dashboard, I would click View Applications. Underneath this EApplications, I'd click View Active. So maybe I've already started an EApplication that I want to continue, or I want to see any that are completed. I'll click View Active. And I'll go ahead and walk us through one that I already started today. So here's one I started today, United World Life Insurance Company, and I said it was for Maria again. It's incomplete, but I did start it today, so I can click Edit and go back into this e-application. I wanted to fill it out most of the way so that you can see the functionality. So again, we've started here. We ran a quote, a Plan G. It has the premium listed here. It's for a female, age 65, non-tobacco. And you can see any of the sections that I've already completed are green. They have green check marks here. So if I want to go back and double check any of these sections, I can just click this section instead of clicking the previous arrow and going all the way through. I can just go into each of the sections and you can see the information that I filled out. The great thing about this e-application is it's a smart e-app. So anything I change along the way that would change the premium amount and it would change the price for our client, it's going to do that as we go. So for example, this household premium discount information, if they were to qualify for the household discount and we entered qualifying information for this person, it would change the price to reflect that they qualify for the household discount. Same thing goes if we were to change the plan type. So if I change from Plan G to a Plan F while doing the application, it will change the price to reflect that information. So we go through each of these sections here. We went through the applicant information section. That's pretty self-explanatory. It's the applicant's information, their first and last name, address, all that information. We have their Medicare information here, so you can enter in all of that information, their Medicare Part A and Part B effective dates, or if they're applying during an open enrollment period. So, for example, if I were to select full underwriting, but really they qualify for open enrollment, I'll get a notification telling me that they actually apply during an open enrollment period and to change my underwriting type. So it's going to catch all those things for us, which makes it really, really nice for the agent. It's pretty much foolproof. It's hard to mess up because it catches all those things. It's a smart e-app. It will catch any price changes, any medications, any of those things it's going to catch for us as we go through. So once I've gone through all that, I can choose where I want this application delivered to, or this policy delivered to. So I'll say the applicant. We're saying we've accurately read or recorded this information and that we've interviewed the proposed applicant, and then we can add any notes to underwriting. We can also add in any documents, so evidence of termination or evidence of insurance. We can choose the files we want to upload and add those in here. And once we've entered everything, we have green check marks all the way down, meaning we've completed all the sections in their entirety. We'll click Verify Application. Now, I do not actually want to submit this because we're actually live here. I'm really in your tool. So I don't really want to submit this application, but I will show you how to do so. We just won't do that very final step so that I'm not actually submitting an application. So once we have everything completed here, we'll do the lock and e-sign. Again, we can review all these sections. If I made a mistake anywhere, I can click Edit Section. It will take me right back in so that I can go ahead and change those things. And then we'll go ahead and click I agree. So this is our applicant, and they're going to consent here. We'll click Continue. Again, we can always click Print for signature, and then they can do a wet sign, but then you'd have to mail it into the carrier. So if we're doing the e-signature, we would actually not want to print it. It will ask us if we're in the same physical location as our client. If we say no, we will have to do the email signature, so it will email it to the applicant. Again, they'll receive a link and a verification code. So they'll just click that link, enter the verification code in order to sign. But if they are in the same physical location, then they can just provide the identifying information, which is mother's maiden name and last four of the social security number. Once we've entered all that information, we'll click Apply e-signature as the agent, and then we'll click Sign Application. Again, I'm not going to do it today, so the only thing I'm not doing for you here is clicking Sign Application because I don't want it to actually submit since we are live. If we go back to the e-application dashboard, once we would submit this application, we would see the policy number populated. So if this carrier gives us a policy number right away, it would be listed here. So we said consented because Maria has essentially signed, but we did not actually submit it because I don't want it to go. But we would have a policy number here that we can go ahead and track the status of by copying that policy number and checking at the carrier's website. So that is our e-application. It's really great to be able to quote and submit applications all in one place. So we're going to move to the very last piece, which is our new client manager. So I showed you how you can create a new client when you're running a quote or select clients to run a quote for. Now let's actually click View Clients and go into the Client Manager dashboard. Here's where you can see all of your clients listed. So this would have any clients you've already created. And the best part about this Client Manager is it's saving you time and it's saving your clients money because you're able to run any quotes for them and compare it to the plans that they're already on. So we have 3 ways to get here to the Client Manager. You saw me go here from the dashboard by clicking View Clients, or I can run a quote. So there's a few different ways to navigate here. We can search to find any client. So maybe I'm looking for Maria again. If I type her name in, you can see that Maria comes up in our results. So if you have a lot of clients, we can search for them that way. We can view any training guides. So we have a lot of great videos on how this works if you ever need a refresher. We also have a client import example here to show you how to import clients. If you have maybe a lead list and you're needing to import a whole list of clients, we can actually import them all at once. We have a training guide here as well, and like I said, other videos if you'd ever like to view those. We can also, if we have a lot of different clients here, we can see how many we want to be listed at once, so 25, 50, or viewing all of them in a list, and then we can go between the pages to view our clients. But we can actually open up a client's information here. So I have Henry McDonald, we have the gender, tobacco use, date of birth. We can add in their phone number, their email address, their address line. We can choose their state and zip code, whether or not the household discount is applied for them. And then if we want to run a new quote for this client, we simply click New Quote, and then we can click which product we'd like to run a quote for, and it will take us directly into that quoting tool. So then you can see here that it's going to have our quote page. It enters in his name, and it automatically pulls in all of his information. So then we can hit Get Quote, and it will actually show us his full result list. So that's how you can run a quote directly from the Client Manager page for a particular client. We can also add in, so of course here's our results. We went through that with the Medicare Supplement quoting tool. So I'm going to go back to our Client Manager. We can also create new clients here. So if we click New, we can add in, we'll say MC Test again. We can select a gender, tobacco status, the date of birth. You really want to make sure you select a proper date of birth here because, we'll say they're 1955. Because this is how you can then run a quote later for this person because it has their date of birth, their gender, tobacco status. We also want to add in their state, so we'll say Nebraska, and their zip code. So anything that you need to enter to run a quote, we want to make sure is saved here for this person so that if we're doing a quote for them, it has all the information right there in the system to be able to run a quote for them. I'm going to go ahead and select some clients to run multiple clients at once a quote. So maybe I say I want to find all of my Nebraska clients to run a quote for them. We can create a filter. What happened here? I'm going to hit back. Bear with me here. I can create a filter so I can find all my clients at once. Like I said, add a filter. Maybe I want to say all my clients that are from Nebraska, and I could select them all at once. So it would pull all those Nebraska clients up, and then I can actually select my clients that I want to run a bulk quote for, so multiple quotes at once. So maybe I want to do Taylor McDonald here and Jane. Then I can click bulk quote, and then you can choose how you want to run the quote. So maybe you want to run it based on their current plan, or maybe I want to run a plan G for my clients I selected. And then I can choose if I want to select just a few companies or maybe all companies to run this quote for. But in the end, it's going to only pull the top 3 best plans for them. So we're not going to see the full list yet, but maybe I want to select all of these. So it says all selected here. So I'm going to run a quote based on all carriers. And then I'll hit Get Quotes. Now for these 2 people, Taylor McDonald and Jane Doe, it shows the actual quote that was run, and it's going to show the 3 best plans available for them. So that's how we do a bulk quote. So you can see we have Humana, Atlantic Coast Life, Resource Life. Those are our top 3. So if we add in what plan they're currently on, maybe they're currently paying $110, we have that listed here, we can see that we can actually save them money. If we want to click their full results page, we click View All Results, and it will take us to that full results list if we want to explore all the options for one of these clients. Otherwise, we can export these results, and it will show us these in an Excel spreadsheet for us. So that's a great way to be able to maybe export this if we're doing any client contacts or client reach outs to save them money. We can export that list and be able to reach out to them. We can also import clients. So if we have a lead list, we can browse and we can actually select here our lead list. And again, in this training guides, it will show you how to format this lead list. So when this pops up for us, we're importing our new client list. We can choose which column headings we have. So in my spreadsheet, I had first name obviously listed. I'll drag it to first name. I'll drag their date of birth to date of birth. And I'll drag last name to last name. So I'm actually mapping out this person's name. Whoops, I did not want to put that there. Obviously, you don't want to put last name under address. So let me try that again. I'll show you how to make a mistake so you know how to work around that. So I accidentally mapped it the wrong place. So any of my column headings that have first name, that have last name, we want to map those so it knows which of the columns we have here. So obviously gender, it matched up right away. So I have a gender column in my spreadsheet. Now it's mapping these client properties, so when it shows us this information in the tool, it knows what's the first name, what's the last name, so I'm just validating each of these pieces. So again, we could have last name, we could have date of birth, and if it's something like city, maybe we had city listed there and that's not something we need, then we don't need to map every single section, but we want to map the ones that we do have, and then we'll click Map Headers and Upload. So this way, it has Julie, Hank, and Tom. These are my leads I uploaded. And it already mapped their information. See, it knew their state and knew their gender because we mapped each of its different pieces of information. So now again, I could do a bulk quote for these people. They're my new leads. Maybe I say I want to do a Plan G for each of them. I can select Plan G. And then I can select which carriers I want to run the quote for. Maybe I click Select All. And then I can hit Get Quote. So again, that's how you would upload maybe a leads list. And then you can run a bulk quote for them. And of course, it doesn't have their last name in there. I can always go back in and add in their last name and edit these client settings in my client manager. So I'll take us back to our client manager dashboard. Of course, this is where we have all of our clients listed. That's how you run a bulk quote, and this is how you edit their different information. So there's a lot of different ways to actually manage your clients all in one place. And the greatest thing about this tool is you're able to run quotes as we went over. So we can run Medicare Supplement, Medicare Advantage, final expense, hospital indemnity, and dental quotes. We can run e-applications and submit them directly to the carrier. We can do the document locker with the electronic scope of appointment form and the client manager all in one place. So it's an all-encompassing tool all here on Medicare Compare USA's online quoting tool. Thank you so much for watching. If you ever have any questions, please let us know. We hope you have a great rest of your day.